Welcome to Pharmacology Outline channel. In this video, we will talk about drug distribution. Drug distribution is a critical step in the pharmacokinetic process, influencing a medication's efficacy and safety. Following administration, a drug undergoes a series of processes, collectively known as pharmacokinetics. These processes include absorption, distribution, metabolism, and excretion. Drug distribution refers to the reversible transfer of a drug from the systemic circulation to various tissues and organs within the body. Several factors influence the distribution of a drug within the body. Physicochemical properties of the drug. Lipid solubility. Lipophilic drugs readily cross cell membranes and distribute more extensively into tissues compared to hydrophilic drugs. Molecular size. Smaller molecules generally distribute more readily than larger ones. Degree of ionization. Ionized drugs are less likely to cross lipid membranes and tend to remain in the bloodstream. Physiological factors. Blood flow. Organs with high blood flow receive higher drug concentrations initially. Tissue permeability. The integrity of capillary walls and the presence of specific transporters in tissues influence drug entry. Protein binding. Drugs can bind to plasma proteins, primarily albumin, and tissue proteins. Protein-bound drugs are inactive and cannot reach target sites. Volume of distribution. A high volume of distribution suggests extensive tissue distribution, while a low volume of distribution indicates limited distribution. There are 4 patterns of drug distribution. 1. Drugs distributed in the plasma compartment, intravascular compartment. These drugs remain primarily within the blood vessels and do not extensively distribute into other tissues. 2. Drugs distributed in the extracellular compartment. Drugs in this category distribute into both the plasma and the interstitial fluids, the fluids surrounding cells, but do not penetrate cells. 3. Drugs distributed in the extracellular and intracellular compartments. These drugs have the ability to penetrate cell membranes and distribute throughout the entire body, reaching both extracellular and intracellular fluids. 4. Drugs specifically concentrated in certain tissues. Some drugs have a high affinity for specific tissues and tend to accumulate there. This selective distribution is seen with drugs like iodine, which concentrates in the thyroid gland. Barriers to drug distribution. Several physiological barriers restrict drug distribution. Blood-brain barrier. A highly selective barrier that limits the entry of many drugs into the central nervous system. Placental barrier. Prevents the passage of many drugs from the mother to the fetus. Blood-testis barrier. Protects the testes from harmful substances. Clinical implications. Understanding drug distribution is important for several clinical applications. Dosage optimization. Volume of distribution helps determine appropriate dosing regimens. Drug-drug interactions. Protein binding displacement can increase the concentration of free drug, potentially leading to toxicity. Therapeutic drug monitoring. Monitoring drug levels in blood or tissues can help assess distribution and adjust dosing accordingly. Personalized medicine. Factors such as age, weight, and organ function can significantly influence drug distribution and require individualized dosing strategies. In conclusion, drug distribution is a complex process influenced by a multitude of factors. Understanding these factors is essential for optimizing drug therapy and minimizing adverse effects. Thank you for watching. If you enjoyed the video, please like and subscribe for more pharmacology insights. Hit the bell to stay updated. Keep learning.